and predictive approaches to research that can better mimic human biology and responses. By acknowledging these scientific limitations and embracing innovative technologies, researchers can improve the quality and accuracy of their research while upholding ethical standards and promoting the welfare of animals. Financial burden. Conducting animal experiments, especially multiple tests required by regulatory bodies, can be costly and inefficient, consuming resources that could be better allocated to more promising research methods. This financial burden adds to the negative impact of animal testing. Animal testing imposes a significant financial burden on researchers, institutions, and taxpayers. The costs associated with housing, feeding, and caring for animals, as well as the expenses related to conducting experiments and maintaining facilities, can be substantial. In addition, the need for a large number of animals for testing purposes increases the financial strain on research budgets. Furthermore, the high failure rate of drugs and treatments that are successful in animal studies but do not translate to human health outcomes add to the financial burden of animal testing. Overall, the financial costs of animal testing are considerable and raise questions about the cost effectiveness and efficiency of this research method. High failure rates. Despite successful results in animal trials, many drugs and vaccinations fail in human clinical trials, indicating the limitations of using animals as models for predicting human responses. This highlights the need for more predictive testing methods to improve research outcomes. The high failure rates in animal testing can be attributed to several factors, including the sociological differences between animals and humans, the complexity of human disease, and the limitations of animal models in predicting human responses. Studies have shown that a significant number of drugs that pass animal tests fail in human clinical trials, highlighting the lack of reliability and predictive value of animal testing. These failures do not only waste time and resources, but also pose risks to human health and safety. As such, the high failure rates in animal testing underscore the need for more innovative and accurate testing methods that can better predict human responses and improve the efficiency and effectiveness of scientific research. Lastly, alternative methods. There are now advanced, more accurate, and humane alternatives to animal testing, such as cell cultures, computer models, and human-based assays. These methods offer better predictivity and relevance to human biology, reducing the need for animal testing and promoting better research practices. Some of these alternatives are in vitro testing. This method involves conducting experiments using cells, tissues, or organs grown in a controlled laboratory environment. In vitro testing can provide more accurate and relevant results compared to animal testing and allow scientists to study human cells directly. Another method is computer modeling. Computer simulations and modeling techniques can be used to predict the effectiveness of chemicals and drugs on the human body. These virtual models can save time and resources while also reducing the need for animal testing. Microdosing. This method involves administering small amounts of a drug to human volunteers to study its effects on the body. Microdosing can provide valuable information about drug metabolism and toxicity without the need for animal testing. Lastly, organ-on-a-chip technology. This innovative approach involves creating miniature human organs on microchips to mimic the structure and function of real organs. Organ-on-a-chip technology can provide more accurate and relevant data compared to animal models. Overall, these alternative methods offer more ethical, cost-effective, and scientifically valid ways to conduct research and testing without the need for animal experimentation. By adopting these innovative approaches, scientists can improve research outcomes while also upholding ethical standards and promoting animal welfare. The harmful effects of animal testing on animals, the questionable scientific validity of its findings, and availability of alternative testing methods highlight the need to abolish animal testing and promote ethical and responsible research practices. The ethical concerns surrounding animal welfare, coupled with the limitations of animal models in predicting human responses, call for a shift towards more innovative and accurate testing methods that not only protect animals but also enhance the reliability and relevance of scientific research. By advocating for the adoption of alternative, more predictive methods and investing in cutting-edge technologies, the scientific community can uphold ethical standards, improve research outcomes, and ultimately advance human health and safety. It is time to prioritize well-being of both animals and humans in scientific research and move away from the outdated practice of animal testing towards a more ethical and effective approach to advancing scientific knowledge. Thank you.